Our group's focus is on HIV/AIDS, Africa's epidemic, and the West's response, by Edwin, Mia, Evelyn, and Alexis. Just based on the title, we can deduce that the parties involved in this discussion are largely those players and states in the United States and the European Union, making up the West and then Africa. We'll be talking about pharmaceutical companies in a global sense, and we'll be focusing on their contributions, or lack thereof in some cases, to Africa in their struggle against the HIV/AIDS epidemic. Additionally, we'll be looking at the United States' response as a whole and legislation or assistance they provided, along with the EU's response as a whole and legislation or assistance they provided. The second section, involving the United States and the European Union's contributions, is meant to further the conversation on whether humans or states owe anything to other humans or states. The present distribution of power is pretty plain to see. Let's look at the states and measure of power through GDP. First, the United States holds the most power, partly because of their ability to influence global economics. Its present GDP, according to the 2019 World Bank report, is over 21 trillion US dollars, which is the highest in the world. The European Union comes in second place with a GDP, as of the World Bank's 2019 report, 15.59 trillion US dollars. Africa, specifically sub-Saharan, is in third place with a 2019 World Bank GDP measurement of 1.76 trillion US dollars. And lastly, as of the end of 2019, the total global pharmaceutical market was valued at about 1.25 trillion US dollars. The order of cases we will be focusing on is 1. Pharmaceutical aid to Africa, 2. US aid to Africa, and 3. European Union aid to Africa. Before we get to the cases, we need to discuss why it is an issue of justice. Why should we understand this issue as one where justice is an important concept? Well, we should understand Africa's HIV/AIDS epidemic and the assistance it both has and has not received as an issue of justice, because it poses as a catalyst to creating a very important set of questions like, do big states owe anything to a nation that is exceptionally burdened by poverty? Should states tolerate inequality in some areas so that others can thrive? Should we think about non-discrimination in terms of geographic locations, similarly to how we view race and class? What roles do pharmaceutical companies play? Well, we have to look less at what states owe to other states and more at what people owe to people. Then we arrive at the question, do people owe this to people? To condense these questions a little bit, I'll pose them broader and more holistically. Are states obligated to help other states with health care and the well-being of their citizens? What place do they have? Then, are states entitled to receiving help from other states? What do they deserve? Lastly, what should pharmaceutical companies and the entire industry, specifically as non-government organizations, be expected to do when it comes to the concern of the well-being, health, and safety of other humans? Should they even care?
First identified in 1981, the HIV/AIDS epidemic acts as one of the largest threats to global health. Yet, until the late 1990s, when tens of millions of Africans were HIV positive, the United States paid little attention to the disease quickly spreading throughout Eastern and Southern Africa. During the 1990s, President Bill Clinton placed immense pressure on South Africa to respect American pharmaceutical companies' patent rights, disrupting South Africa's efforts to obtain low-cost generic medicine for AIDS patients. By the early 2000s, the US had begun to understand the implications of globalization and, if left untreated, how the HIV/AIDS epidemic threatened political, economic, and security interests of the US. In response to this concern, the US shifted focus to increasing international efforts to combat the HIV/AIDS epidemic in Africa. In 2003, President Bush announced the President's Emergency Plan for AIDS Relief, or PEPFAR, during his inauguration address. Prior to PEPFAR, the US allocated only $500 million annually to globally fight HIV/AIDS and offered no clear plan to curb the epidemic. Since its initiation, the US government, through PEPFAR, has invested over $85 billion in HIV/AIDS efforts, making the US the largest donor. Additionally, PEPFAR has trained over 200,000 healthcare workers to treat and improve HIV care in sub-Saharan African countries. Another key US advocate in the HIV/AIDS epidemic is the United States Agency for International Development. Initially, the USAID took a health-directed approach to fight the epidemic, but because of the multifaceted nature of the disease, the USAID expanded to a more developmental-oriented approach, focusing on the social, economic, and governance aspects of the epidemic. Thanks to the funding PEPFAR provides, the USAID's efforts have intensified since PEPFAR's establishment. Although critics acknowledge that the total amount of funding given by the US to Africa is small relative to both the world and the country's needs in dealing with the epidemic, the US has been the leader in providing bilateral funding in hopes of ending the HIV/AIDS global health crisis.
The HIV disease was first identified in the UCLA Medical Center in 1981. However, it had been spreading before it was even identified. The hardest hit countries from this epidemic quickly became the poor nations in the sub Saharan African region. In a surprising pharmaceutical achievement, within 4 years, the first drug to treat HIV was created, and by 1995, there were discoveries made that led to the highly active antiviral therapy, which continues to be the cornerstone of HIV treatment. Pharmaceutical companies have invested a lot of time, research, and money into creating these treatment drugs. This investment was made without the guarantee of any profit or recuperation from that investment. Due to the intricacies of the HIV/AIDS disease, the treatment often involves the use of multiple drugs and requires consistency in taking the medication. Unfortunately, due to the development of drug resistance, you also need to switch drugs. So to the right, you can see an example of the HIV medication chart. This is just an example of the different types of medications that may be taken and switched out between in order to prevent the HIV from becoming a full-blown AIDS infection. As you can imagine, this medication is quite expensive, as the pharmaceutical companies are essentially just trying to make a profit off of this. In America and other Western nations, this isn't necessarily a huge issue due to healthcare, but in places like sub-Saharan Africa, where the nations are extremely poor, this prevents people from being able to get the medicine needed for them to live and causes them to die. The reason that companies are able to keep these prices so high is because once they were developed and proven effective, the companies patented them, which prevents generic brands from existing for a set number of years, which allows pharmaceutical companies to charge exuberant prices in order to make a large profit. The patents held, as I just said, allow them to sell the drugs for far over the manufacturing price. They make a ton of profit off of these drugs. This prevents people in poor countries from being able to afford them. In wealthy countries, it's pretty easy to afford them due to the healthcare, but if you're in a poor country, there's not a lot of healthcare, you simply cannot afford the drugs that you need to survive. Despite this, pharmaceutical companies have argued that the patents are necessary to protect their intellectual property and allow them to recoup their investments. These patents are protected by international law, such as the TRIPS agreement, which essentially states that all countries in the World Trade Organization must honor patents. There are some exceptions made which allow generic products to be sold or prices to be lower, but it's not nearly enough to help the countries in sub-Saharan Africa. As you can see in the graph, exceptions are rarely granted and they aren't really that beneficial. The pharmaceutical companies' insistence on making a profit and protecting their intellectual property suggests that to them, profit is more important than human lives in Africa. This is an issue of justice because they're making the price of life-saving drugs too expensive, which means they are placing profit over human life. Humans have the right to be healthy according to the International Declaration of Human Rights, but this is being ignored by the pharmaceutical companies in their effort to protect their own intellectual rights and in order to get a profit. The international community's initial reluctance to enforce the exceptions in the TRIPS agreement implies that both the pharmaceutical companies and the World Trade Organization believes that only those in wealthy countries that can afford a consistent supply of various medications deserve to live. Additionally, as the HIV and AIDS disease is mutating, as scientists suggest it will, the medication soon will not be the same between Western countries and countries in Africa. There is no guarantee that pharmaceutical companies will make drugs that are needed in Africa if there's no profit to be had from them. So this means that there's a potential for there only to be access to necessary drugs for survival in American and Western nations that can afford them.
South Africa has more people living with HIV than any other country. In 2010, an estimated 5.6 million people carried the virus. To increase the positive impact of AIDS and HIV responses, the European Union launched a €126 million primary healthcare sector policy support program for South Africa. This program stands as one of the largest European Union health programs in the world. By creating this program, the EU is trying to support the South African government in its efforts to improve access to healthcare and to raise the quality and management of the health system. It has long-term goals of increasing individuals' life expectancy and reducing maternal, infant, and child mortality. Since 2003, the Global Fund has helped finance the fight against HIV and TB in South Africa through providing grants to government agencies and non-governmental and private sector organizations. NACOSA, a South African civil society network, is among one of the recipients of the funds from the Global Fund. The NACOSA network covers over 1,500 organizations that are active in the fight against HIV, AIDS, and TB. NACOSA runs trainings and mentoring activities and works to ensure that there is a united response across all parties involved, so that the impact of their aid is maximized. The Global Fund aims to address health in a comprehensive way. Part of the money is used to implement the multi-sectoral National Strategic Plan, a task jointly carried out by various government departments as well as businesses, civil society, and local authorities. The support provided to South Africa is part of a wider European Union effort to halt the epidemic and help those who have contracted the virus. The European Commission and European Union member countries together represent more than 50% of the overall contributions to the Global Fund. The European Union had contributed a total of €923 million at the end of 2010. In hopes to develop a coherent policy framework, the Commission launched the European Programme for Action to confront HIV and AIDS, TB, and malaria through external action, covering all developing countries. HIV and AIDS is prevented through intervention. Geographical and thematic actions are taken at a state level, as well as in other sectors of life, like education, transportation, and infrastructure and housing. HIV and AIDS do not overlook any part of an individual's life, so neither does the initiative taken by the EU.
Fortunately, thanks to global efforts, HIV no longer means a fatal diagnosis. In 2019, PEPFAR announced that Botswana, Cambodia, Ethiopia, and Rwanda are on track to control their HIV/AIDS outbreak by the end of 2020. For U.S. aid to Africa, as stated in PEPFAR's 2020 annual report to Congress, they are working on supporting the African countries who are said to be falling behind in HIV/AIDS prevention efforts. PEPFAR reports that they are providing countries with customized solutions, increasing HIV testing and linkage to care, widening the coverage of treatment, and implementing policies to ensure individuals have access to client-centered HIV prevention and treatment services. The European Union is taking efforts to do the same. Through their launching of the €126 million primary health care sector policy support program for South Africa, the European Union is taking initiative in the fight to combat as well as stop the spread of HIV/AIDS. But there are still currently over 20 million people in Africa living with HIV, and millions of people are still vulnerable to infection. As long as American pharmaceutical companies maintain high prices for their life-saving medicine, millions of HIV-positive people in Africa will ultimately suffer or die from their actions.